welcome to Here's to Your Health. I'm your host, Veggie Patty, and it's my pleasure to bring you information on healthy living. On today's episode, we are filming on location at the Michigan Science Center. And with me today is Shannon Mackey. She is the marketing coordinator for the Michigan Science Center. So thank you for letting us come to film.
I'm happy that you're here. Thank you.
So today's episode is actually about colorectal cancer awareness. And the Michigan Science Center has partnered with Karmanos and Bayer Health to bring the display of this giant colon, which we're going to be walking through shortly. So can you talk to us a little bit about how this partnership came to be and how this display came to here at the Michigan Science Center?
Bayer and Karmanos approached us about hosting this exhibit here, and we were really excited about that because we really want to encourage STEM education, science, technology, engineering, and math. And we're all about being a community partner too, and they're our neighbors. Karmanos is our neighbor here in Midtown, and we just really like to support the community and spark that interest in STEM for kids.
Great. Well, thank you so much for allowing us to come here and film, and I know everybody wants to take a walk inside this giant colon back here, so we're going to be right back and take you through. I'm here with Linda Kernick. She is a clinical nurse educator with Bayer Healthcare. So Linda's actually going to take us through the colon. So thank you so much for talking to us today, Linda.
Oh, I'm very glad to have the opportunity to share awareness of Colorectal Cancer Awareness Month. So as you know, March is Colorectal Awareness Month. And there's a big push because it's such a preventable disease in trying to get education out about screening. So if you were to stop by our display today, the first stop you would have been at our table. And that's where we have a number of things to help really demystify some of, the concepts around colorectal cancer. So this, for example, is the Colorectal Cancer Awareness Pin. That's the Star of Hope. And it just shows support for spreading the message and helping people get over that embarrassment about, the topic of colorectal cancer. We also involve kids in trying to help, make their parents aware. So we have tattoos that are temporary tattoos. And one of the big areas of support has been the booty bracelet.
Okay.
So this year, really, I Love Booty is a big message to help, spread the word that if you have a loved one and you're really concerned about them, you're going to really help them be aware that once you reach a point of 50, routine screening can save lives. So I would like you to wear one if you don't mind.
Great, I will certainly do that. So this is to hit people at all levels. You can, if you want to be a little bit more sophisticated, you can wear the pin. Kids can get involved with the temporary tattoos. And if you love booty, you can get one of these bracelets. And you also have bags too that people can get. So can you tell us, before we walk through the colon, how is Bayer Healthcare involved with this partnership with Karmanos and the Michigan Science Center?
So really, Bayer Healthcare is very much involved in promoting healthy behaviors and really trying to make an impact in the communities on, just general health statements. So, given in the Detroit area that Karmanos is such, a known institution, it gave us a great opportunity to partner on an educational initiative to really have a far reach into the community where we can really spread the word, and then, hopefully this will springboard into other things, so we do the colon event here, and then Karmanos continues to carry that message through the year, just on healthy behaviors and especially how to use prevention for something like colorectal cancer.
Great. All right. So we're going to start taking a walk through the colon now. So for all of you viewers that are wondering what a colon actually looks like, today you're going to get to see in big form what it looks like and all the different things that can happen inside. So Linda, go ahead and take it away.
Exactly. So imagine when all the kids walked in today, our first question was, where's your colon? And some kids were pointing here, some kids were pointing here, but really we want to give them an idea of, once you open your mouth and the alimentary tract goes all the way through your body, what would they actually see if they passed the camera through? So with colorectal cancer screening, one of the mainstays of screening has been a colonoscopy. So imagine, we've had a camera going through. Basically, if we look over here, this is what the normal mucosa would look like. So essentially, it should be shiny, it should be smooth, healthy tissue. So if you even opened someone's mouth and you looked in their mouth, you would see that nice glossy surface. this is what the goal is, to maintain the colon in a healthy environment like this.
Okay.
Now, as you know, as we age, one of the risk factors for colorectal cancer really is age. So the incidence increases over the age of 50, and that's really when we recommend for most people screening starts, because if you develop polyps, they take a long time to develop in the body, and those polyps are what can develop into cancer. So I'm going to point out some of the areas of the colon here.
Okay.
You see now that nice smooth surface has become bumpy with these growths, right? So if a patient actually has some of these polyps internally, you may not have symptoms at all. And that's one of the things about colorectal cancer. Many times, until it progresses to a later point, patients don't have symptoms. So the ability of screening lets us have a look to see if these precancerous growths are starting to form. And if you actually take those out, for example, during a colonoscopy, then you remove the potential for them to become cancerous. So the kids had a great time today playing around with the polyps.
Yeah, so these in the very, we can see this, these are the bumps, which they call polyps in the colon, and like you said, you definitely want to go in for screenings and they can remove those so they don't turn into cancer.
Now there are some times where you may have a risk factor that is, we call them non-modifiable, that you don't necessarily have control over, that may be because of genetic predispositions. So one of the things that the colon also points out is something like Crohn's disease. So some patients have inflammatory bowel disease, and that's an area where, you know, your colon is put at risk because there's inflammation in there. The body's own cells tend to attack that normal colon tissue, and as you see, you can get areas of erosion here. So that's not healthy tissue like we saw when we first entered. That's an area that's already at risk, and that actually poses you more at risk for developing colon cancer than someone that doesn't have an inflammatory bowel disease like Crohn's disease, ulcerative colitis.
So the erosion is like tears in the healthy tissue.
Yes, absolutely. So, and generally people are under medical care who have this, so they are aware that, you know, they need to be followed closely and screened closely.
Okay. Nice.
So, as we walk through the colon, what you will find is if someone started with a polyp and the polyp was not taken care of, so the polyp was allowed to develop over time, what can happen is then you develop these malignant polyps.
Okay.
So you can see on the other side we saw these isolated spots, and now we've got these large areas where there's been this uncontrolled growth, right? So instead of just one, now we have a cluster, right, of abnormal cells. So this area has already begun to take on malignant forms. And usually malignancy means uncontrolled growth, right? Uncontrolled proliferation. So in an area like this, even something like this can still be dealt with if it's caught early. Because if this is still contained within the colon, then sometimes surgery is enough in order to really cut it out so that it puts the patient not at risk for then developing further colon cancer. So screening, whether it's just to remove polyps or to catch the disease when it's an early state, is so important. So important for patients. So that's what it looks like when it's in malignant polyp form stage. As you look down here, this actually represents how invasive, right, the cancer can become. So instead of even the defined polyps that are actually on the smooth lining of the colon, you get this mass of abnormal cells that just continues to expand. And it not only expands inward, right, because the colon, think of it, it's a tube, so there's space for it to grow inward, but then it can also grow outside of the colon. And that's where we have problems with then having lymph nodes involved, and cancer can spread to other parts of the body. So the real goal is to just educate patients to not be ashamed, not be afraid about going through normal screening, but to really take that as prevention and have the screening test so that they can catch anything early and prevent colon cancer from progressing.
Great. Well, thank you so much, Linda, and thank you for taking us on the tour of the colon. So for you guys that were wondering what it looks like inside a colon, hopefully you got a good view of that today. Obviously, you want to try to do our best to maintain the healthy tissue that you see at the beginning. If you do get screenings and they do catch the individual polyps, they can remove those. And then, of course, if it isn't screened, it can progress, like we saw, to the malignant polyps and then to the colon cancer. So we're going to be right back in just a few minutes, and we're going to have another person talk to us from Karmanos to tell us all about those risk factors and things that we can do to help prevent the disease and to catch it early if you are at risk for cancer. So thanks again, Linda.
It was a pleasure.
And we will be right back. I'm talking with Laura Zubek now. She is the Director of Patient Community Education at Karmanos, and she's also a registered nurse. So thank you for talking to us today, Laura.
Thank you. This is wonderful.
So can you tell us, first of all, some people haven't heard the term colorectal. They've heard of colon cancer or rectal cancer. So what is colorectal cancer?
It's cancer that involves the colon and or the rectum.
Okay. So we just got the tour inside of the colon. And so we see what can happen, but can you talk about what are the risk factors that might make people more prone to getting colorectal
Risk
cancer?
factors may include family history. They may include poor diet or health habits.
Okay. What about the symptoms that people could experience?
Anything that's different than your normal habits.
Okay.
If your bowel habits change, if you notice things that weren't there before, possibly blood in the stool or different colors, this may precipitate you to go see a doctor.
Okay, and I did read that sometimes there's no symptoms at all, which is
Correct.
kind of a scary thought.
It is scary. It is scary.
So it's really important to get those screenings. So what are the recommendations that Karmanos has or that the American Cancer Society has for getting screenings?
Begin colonoscopies at age 50. Know your family history so that if there is a first-degree relative possibly that had colorectal cancer, you would start your screenings earlier.
Okay. Now, I did also see a statistic that said that colorectal cancer is the second leading cause of cancer death, yet it's 90% treatable. So where does that disparity come from?
I think there are a lot of cultural and personal beliefs that people don't want to know, or they're afraid. They're just afraid. They may not have access, in which case we would direct people to different clinics in the area to provide that.
Okay. So what are some things people can do for prevention?
Eat healthy foods. Include your fruits and vegetables, drink lots of water. Avoid some of the extra things that maybe you don't need, high in fat, high in sugar, those sorts of things.
All right. And then can you talk us through, if somebody has to go to the doctor and they want to talk to their doctor about getting a screening, what does all of that entail? Because I think that's the scary part for people.
It is. It really is.
I don't know what's going to happen to me. I don't want somebody touching my butt.
Exactly. And that's probably a lot of it. What's involved is generally a simple stool test that we do 3 times, not once, but 3 times, to check for occult blood. So that's blood you may not see. Mm-hmm. And then once you turn 50, you would have a colonoscopy. Which is pretty simple. You get a simple prep the night before. You may have to eat a special diet for a day or 2. And they, at whatever facility you go to, would put you into sleep so that when you wake up, it's all done.
Okay.
And they go in and they look at all of your colon and check out to make sure that you don't have any polyps or you don't have any unusual areas that need biopsy or removal.
And I know I've heard people say, well, I don't want to go through the prep, but I think the preps have gotten better over the years.
Easy.
And then other people are concerned that they're going to have pain after the procedure. Is that normal?
None. It's easy. It's one of the easiest tests you can do. It takes a little bit of time, so you may have to, if you're working, take a little bit of time off of work. But simple, really simple and easy.
Right, and considering that, like I said, if you catch things early, it's 90% treatable.
It's curable.
Yeah.
It's treatable.
It's one of the simplest things that you can do to save your life. And so if, talk with your doctor and see when you should start to be screened.
It beats the alternative.
Yes.
Why would you want to come in with advanced cancer? Do your screening early. It saves lives.
Right. Okay, that's great information to get across. And, I want to reiterate to people is that this is the second leading cause of cancer death, yet this is 90% treatable.
Yeah,
and so
exactly.
the reason, people aren't going to get their screenings. And so if you said if there's problems with access to it, there are programs out there to help people
Absolutely.
to provide access so that everybody
Absolutely.
can get a screening. And if it's that if you're just afraid, at least talk to your doctor about it and have the conversation and start the conversation.
Exactly. If you need ways to talk to your physicians, we provide on our websites questions to ask your doctor.
Great. And for children or even adult children that, for your parents, if your parents aren't going to get your screening, maybe you need to start talking to your parents as well and saying, hey, you're of the age, have you talked to your doctor about colorectal cancer? So,
But I think it's also knowing your family history. That's an important part of when you screen.
Yes, exactly. And I think a lot of people have been touched by this illness, whether it's in your own family or a friend that you know. Everybody knows somebody that has experienced this.
Absolutely. Get your screening. It's so simple.
Right.
So simple.
So thanks for telling us about all the risk factors. Can you tell us a little bit about how Karmanos is involved with Bayer Healthcare and the Michigan Science Center? How did this collaboration come about?
Well, it was kind of a funny thing. We are part of our mission at Karmanos is to provide community education, and we partner with many different organizations. Bayer very graciously offered through other projects that we are working on at the Cancer Hospital to provide the giant inflatable colon. So when they did that, we had to look for somewhere to do this, and we thought that the Science Center was a perfect place to do it, to provide educational messaging and the opportunity for people to learn about colorectal cancer. And then when that happened, we engaged other community partners, the Colorectal Alliance, and some of our local clinics and other partners at Wayne State and Oakland Community College, and asked if they would like to come and provide messaging also to educate the public.
Great. Well, thank you so much, and it's wonderful that everybody is working together to bring this information across and in a fun way that people can be educated.
Yeah, and hopefully they'll remember. Right. And if the children come through today, hopefully they take the messaging home to their families that say, get your screening, learn about this. This is important.
Right, great. Well, thank you so much. This is critical information we want to get across to the public. So we will be right back in just a few moments. I'm talking with Denise Henderson. She is a nurse educator with Karmanos. And so she has one of the display booths here today outside of the giant colon. So thank you for talking to us.
Oh, thank you for having us here.
So I wanted you to show us, we already walked through the big colon and you guys saw on a big scale what polyps and everything look like, but you have some models that are more realistic scale. So can you talk about the models and what people would be seeing, or actually what the doctors would be seeing if they're doing colonoscopy?
Well, what we brought today were several models, and a lot of people actually don't know where their colon is or what their colon actually looks like, or actually what their colon does. So our purpose here is a little bit twofold. One of our missions at the Institute is to educate so that eventually we can eradicate cancer. So we brought a little colon, and this is almost what your colon would actually look like if you were to look inside the stomach. And here's a polyp, and the whole point of getting rid of polyps is the fact that colorectal cancer is actually preventable. We're sort of lucky in the fact that colorectal cancer usually tends to grow slowly. But by the time that we're 50, and we've had bad diets and not enough exercise and not enough fiber, sometimes we tend to get polyps. So at 50, the gold standard test is a colonoscopy. And while you're prepped and having your colonoscopy, the doctor can actually remove polyps from the colon to keep them from getting to be more cancerous. And over time, this is what can happen to polyps if they're not removed. So when you get to be 50, have a colonoscopy. If there's nothing untoward in the colon, then what actually happens is that you don't really need another colonoscopy for 10 years. If you have a family history of colon cancer in your family, however, it's recommended that you really do start colorectal cancer screening in your 40s. This just shows another polyp, and this is really stage 1 for cancer. These are removable. Therefore, colon cancer is really preventable. If polyps aren't removed, sometimes they grow into stage 1 and stage 2 cancers. These are usually still inside the colon. And by the time we get to a stage 4 cancer, it's advanced and usually more outside of the colon.
Right, and this is what Linda was talking to us about earlier when we were going through the giant colon, was that it can grow outside of the actual colon.
So in the preventive realm, unfortunately, tobacco products will cause 30% of all cancers, up to and including colon cancer. A lot of people think that colon cancer is diet and exercise related only, or that tobacco only affects the lungs. So we always sort of like bring our tar jar, which is representative of this is the amount of tar that ends up in your lungs and throughout your body if you smoke just a half a pack of cigarettes a day for a year. And unfortunately, we find that a lot of kids start in their early teens, 12, 13, and 14. The other end of that is diet and exercise. Eating 5 to 9 servings of fruits and vegetables a day, along with children getting an hour of exercise a day, is really the best preventative medicine for preventing colorectal cancer.
Great. Well, thank you so much for talking to us and sharing that information. And it always helps to have visuals, and so it helps to have visuals on different scales. And this, she said, this tar jar is just amazing. A half a pack of cigarettes a day. This is what would be in your lungs after a year. And obviously that affects a lot more than just your lungs. So thanks again, Denise, for talking to us. And we're going to be right back with everybody to close the show. Well, I hope you learned a little something today about colorectal cancer awareness and the importance of getting screened. I wanted to thank everybody here from all the teams at the Michigan Science Center, Karmanos, and Bayer Healthcare for allowing us to come and film, and also for hosting this wonderful exhibit for the public to bring the awareness to you. Remember that no matter the cards you were dealt or your current state of health, you have the power to take charge of your health. So never give up and never stop learning. The solution you seek may be just around the corner. If everybody can join me in a toast, I would like to wish all of you a wonderful today and an even better tomorrow. Here's to your health.
Cheers.